Winter Garden Community Analysis by Camille Davis and Salina Williams at St. Petersburg College.
Winter Garden is a city located 14 miles west of downtown Orlando. Settlers began arriving in the Winter Garden area by the 1850s. The settlers were engaged in citrus and vegetable farming. By the end of the 19th century, Winter Garden Business District had grown up alongside the two railroad lines that run through the city. Winter Garden was established in 1903 and officially incorporated as a city in 1908. In 1920, the population had grown to over 1,000 people. Lake Apopka that bordered Winter Garden emerged as the largemouth bass capital, attracting many tourists to the area. The Edgewater Hotel opened in 1927 to accommodate these visitors. Winter Garden's rapid development slowed in the 1960s due to Lake Apopka becoming severely polluted, and the construction of major highways in the area drew businesses away. In 1996, downtown Winter Garden was listed on the National Registry of Historic Places after concerned citizens and community leaders rallied to rescue the commercial district. The establishment of the West Orange Trail attracted thousands of visitors to the area, eager to patronize the new shops and restaurants that moved in the old buildings. Today, Winter Garden Historic District serves as a successful example of historic preservation. The area has undergone redevelopment, repurposed buildings, preservation, housing, and all these businesses converge to create a thriving downtown that draws people from all over the world. Winter Garden has continually met the needs of the community by providing housing that is sufficient and adequate. Winter Garden continues to grow by making improvements to the infrastructure of the community, such as roadways and neighborhoods. There are 5 low-income housing apartment complexes in the Winter Garden area. Low-income, disabled, and elderly individuals are eligible to be considered for affordable housing. Winter Garden currently has an initiative in place to accommodate low-income families to become homeowners by offering an income-targeted units that are affordable. Federal, state, and local resources are being utilized to rehabilitate existing homes to allow residents to remain in the community. Winter Garden has 12 elementary schools, 4 middle schools, 2 high schools, 2 charter schools, and 8 private schools. Orange County Public School System is the 9th largest school district in the nation. Orange County Public Schools is very diverse and has 194 countries represented with 170 different languages spoken. Orange County Public Schools offer students a variety of academic options at each grade level. Students can choose to enroll in a magnet program or design their own path by enrolling in selected courses of their interest. Winter Garden offers the community different options of worship. The worship times varies depending on the place of the worship. Some of the places of worship have programs in place to address the needs of the community, such as providing clothing and food. The roads in the area are in good repair and easily accessible. State Road 50, known as West Colonial, is a major 4-lane road and it is in good condition. Sections of the road is being repaved. The road is busy and congested during rush hour. The toll road, State Road 429, is another major road in Winter Garden, and it links to the major interstate. Members of the community can also utilize the public transportation system known as the Links. The Links bus is accessible to the handicapped patrons and able to accommodate individuals in wheelchairs. Uber and Lyft have become popular optional modes of transportation in the area. Taxi cabs were noticed in the community during the windshield survey. Winter Garden has 2 high schools in the community. This is problematic and it leads to overcrowding in the classrooms. Teachers are constantly trying to come up with innovative strategies to work around the issues. This leads to less instruction times with the students, which equates to lower test scores. Orange County is in the process of building more schools to accommodate the students. However, the fix will not occur overnight. Winter Garden has walking and biking trails that are free to be utilized by the residents. This allows citizens to engage in outdoor activities, which improves health. There are also local parks in the area that the residents can enjoy.
Population of Winter Garden. There are a few population issues in the community that are of concern. The population consists of 43,536 people, and 62.7% of the population are Caucasian. The rest of the population consists of minorities. Minorities face more health disparities, such as higher chance of developing a disease, earlier frequent mortality rates, poor quality of life, faster progression of disease, and increased global burden. Minorities have a limited number of health services compared to whites, and cultural differences may impact the medical attention and treatment minorities will receive. There is a 5.1% of people unemployed and 9.3% of people below poverty line. Individuals below the poverty level have health concerns because they are at risk for different chronic health problems. According to the Gallup report, 31% of people below the poverty level suffer from depression. Diabetes, heart attacks, hypertension, and obesity are more common in people of poverty. Unemployed individuals show a higher rate of health disparities and mortality rate. The health concerns of winter garden are similar to most communities. The top three leading causes of death in winter garden is heart disease, cancer, and stroke. Tobacco use is the main cause of death related to cardiovascular disease and causes one of every 3 deaths. To help prevent further cardiovascular damage, the population needs to have frequent monitoring of cholesterol levels, control blood pressure, tobacco cessation, and daily use of aspirin. To help the community to lower their risk of cancer, the population needs the regular cancer screenings, weight control, healthy diet, exercise, tobacco cessation, and low alcohol intake. The communicable disease in the community are hepatitis B and sexually transmitted infections such as chlamydia and gonorrhea. To help reduce the risk of STIs, the community needs to have sex education programs and free testing centers. Hepatitis B is also very common in the community. To prevent hepatitis B in the community, people living with families should have their family tested and vaccinated. Sex education courses should be provided and ways to contract infection should be taught.
Advent Health Winter Garden is the nearest hospital in Winter Garden community. The hospital provides accessibility to residents. However, the facility is only for emergencies. Currently, it's an emergency room only. If the patients need to be admitted, they're transferred to the main Advent Health facility near downtown Orlando. The cost is based on services, and most insurance plans are accepted and self-pay arrangements can be made. There are other healthcare facilities in the area that are accessible to residents. These include Quality Health and Rehabilitation, Advent Health Central Care, AmeriVita Home Care, Choices Counseling Center. Services range from long-term care, x-rays, immunizations, home care, drug and alcohol counseling, and these facilities are available to accommodate the healthcare needs of the community. Prices varies for services rendered. The facilities also have a sliding scale fee for payment based on income. The 3 Healthy People 2020 objectives chosen for the Winter Garden area include cancer, HIV, and nutrition and weight status. There are lots of outdoor activities and beaches nearby that residents can enjoy. Residents are exposed to ultraviolet rays and may not always remember to apply sunscreen or protective clothing, which will increase their risk of skin cancer. Florida has the second highest rate of HIV diagnosis among adults and adolescents in 2015, with 27.9 new cases per 100,000 people. Central Florida, which includes Winter Garden, ranks 6th among U.S. cities for the highest rate of HIV diagnosis. The major roadway in Winter Garden is West Colonial. This road is saturated with fast food restaurants that have unhealthy food choices. These restaurants may add the convenience to the residents, however, eating an unhealthy diet leads to obesity and other health problems.
Adequacy of environmental resources. Sanitation services are adequate in the community. The garbage is collected in every neighborhood twice a week. Recycling is optional for all residents. Hazardous waste services are not adequate because there is no truck pickups. There's an adequate number of parks and recreation opportunities in the area. The community has 10 parks and recreational centers for passive and active leisure activities. The Winter Garden Police Department has 1 location on West Plant Street. Winter Garden has 87 police officers and 30 civilians that covers a 17 square mile area. There's an adequate amount of police to serve this community, and they provide services such as police explorers, neighborhood watch, and a self-defense class to the public. The fire rescue team consists of 47 firefighters and a licensed EMT or paramedic. The fire department works with the Orange County Fire Rescue Department and the City of Ocoee Fire Department. In the case of an emergency, they can respond to cases that is out of their jurisdiction, which can increase the adequacy of service delivered to the community. The City of Winter Garden has a disaster plan for where to evacuate in case of an emergency at the schools or community shelters. The landscape and garbage in the low-income neighborhoods from my observation are not clean and the grass is growing on the sidewalks. Some of the busy streets in Winter Garden lack sidewalks, which can be a hazard to people in the neighborhood. The bicyclists ride in the middle of the street, which can be unsafe for them and can cause an accident, which proves there's a need for bicycle lanes and our sidewalks. The Lake Apopka in Winter Garden is filled with alligators and mobile homes are close by, which can be a safety hazard in the community.
Winter Garden is governed by a mayor and 4 district commissioners. The city commissioners serve a 3-year term. Officials are selected by the district, and the mayor is elected by a citywide vote. The city commissioners establish policies in the form of ordinances, resolutions, or motions which determine laws and proceedings for the service level in the city. The elected officials appoint the city manager who oversees all administrative and daily business operations of the city. Meetings are held monthly and are well attended by the community. For those unable to attend, minute meetings are available online. The budget encompasses all aspects of the community. Funds are allocated for general government, public safety, physical environment, transportation, economic environment, human services, culture, and recreation. There are no areas of economic, political, or public policy concern. The city is in sound financial condition, and the city of Winter Garden continues to maintain a low debt burden and a responsible level of fund balances.
Community needs, problems, or community diagnosis. Cardiovascular disease prevention is important because it is the leading cause of death in the community in the United States. Cardiovascular disease has a mortality rate of 21.7% in Winter Garden and 23% in the United States. The community nurse focuses on how to prevent cardiovascular disease from causing more deaths in the community. The nurse can educate, monitor, and assess the individuals at risk for developing cardiovascular disease. Sex education by the community nurse helps to prevent further contraction of STIs. The community nurse can teach teenagers and adults how to use birth control and condoms. STIs is one of the most common communicable disease in Winter Garden, and the community nurse needs to implement strategies to help the community. Providing free health screenings can help individuals to identify risk factors and health concerns. The community nurse can provide free blood pressure monitoring and assessment to individuals that do not have insurance or minorities who do not have access to health services. The community nurse should focus on diet education for all ages. Winter Garden healthy diet rate is 50.2%. The percentage can be increased if the public adheres to healthy diet habits. The community nurse needs to understand that unemployment is a problem in the community, and not all individuals may have insurance or jobs. This may help in providing care to the community, such as low-cost medication, treatment, and equipment. Concern in the parks are adults smoking around children. Secondhand smoke can cause health risks for children, such as asthma attack and respiratory infections. The community nurse needs to educate parents or adults on the risk of exposing children to secondhand smoke. The prioritization of lists provided is based on 3 levels of health promotion and prevention. The rest of the list was prioritized based on what the community needs the most. Health, diet choices, employment, and smoking in parks are concerns of the neighborhood, but is not very common.